Okay, good morning, good afternoon, everyone. Welcome to lecture 46 of BMS 300. Today we're going to start with part 1 of the digestive system. And before we get started, I wanted to run this survey on behalf of the university, right? So they're trying to see what is the mindset of folks in terms of climate change and wanting to learn more about it, right? So could you please just take a minute to respond to this poll? Like, I would like to learn more about the role of biomedical scientists and healthcare providers play in addressing climate change and other environmental crises and climate-related hazards. So, would you like to learn more about their role? Strongly agree, agree, neither agree or disagree, disagree, strongly disagree. Okay, thank you all for your input. So today we're going to start with the digestive system, and what I want to do in this integration slide is to tell you how the functioning of the digestive system can be influenced by other organ systems, and how the digestive system can in turn have an impact on various organ systems. So we started the first unit by talking about what's going on in the cell. We looked at the structure of water, the various functions of an individual cell, but we see that all these cellular processes which require energy, they are going to use ATP as the energy currency. So we looked at how ATP can be synthesized from a number of substrates such as carbohydrates, proteins, and fats. So all of these substrates for making ATP are made available in the cell through the function of the digestive system. So that is why we eat food, in order for our cells to make ATP, among other reasons. And then when you consider the cell junctions, we see that cells can be held together by different kinds of junctions, and we talked about tight junctions, how they play a role in holding the epithelial cells in the digestive tract. And I told you that one of the major proteins found in the tight junctions are claudins, and how when there are mutations to claudins, it can lead to pathogens getting past the digestive tract and leading to inflammation. There could also be growth factors which can sneak right in, and that can lead to cancers as well. As far as the types of tissues are concerned, we will talk about all 4 tissue types. We'll encounter that in the digestive system. We'll talk about connective tissue, epithelial tissue, muscular and nervous tissue playing a role in the functioning of the digestive system. And then we see that the integumentary system also has an impact on digestive function. For example, the vitamin D precursor is produced in the integumentary system. It's produced in the skin, and that precursor is going to be further acted upon in the liver, and finally the active form of vitamin D will act on the small intestines to help absorb calcium, and the calcium which is absorbed in the digestive tract will be incorporated into the bones, right? And so we see that's how the skeletal system can also be impacted by the digestive function. And when you think about the endocrine function, we find that the pancreas found in the digestive system has both endocrine and exocrine functions. So what we mean by endocrine function is that there are hormones released into the bloodstream, and so we'll see what are some hormones released by the pancreas. And we find that the exocrine function of the pancreas is referring to the fact that there are secretions released into ducts, and so we'll see what are some of those digestive juices which are released by the pancreas. And then as far as the nervous system is concerned, we see that the digestive function will require some voluntary action and some involuntary regulation as well. So the voluntary actions could include you taking the food and eating it, or drinking some liquids. So that's controlled by signals sent from the nervous system. But once you swallow the food, then there's no control over what happens to the food, and that's controlled by the involuntary control from the nervous system as well. And the muscular system, we see that the role of skeletal muscle and smooth muscles will be encountered in the digestive function. So the skeletal muscles could function in the form of helping you chew the food, picking up the food, putting it in your mouth, and the role of the smooth muscles will be in how they can help propel the food along the digestive tract. So we'll talk about how those smooth muscles can accomplish that. As far as the cardiovascular system is concerned, that's going to pump blood to all parts of the body, and we see that the blood is carrying nutrients, and we'll see how, depending on the kinds of food we eat, specifically if there's high amount of fat, that can lead to impact on the heart function as well. And then we see that the respiratory system has a pretty important role on the digestive function. For example, I told you that the sense of smell is possible because of the respiratory system, and so if the olfactory sense is affected, that can impact how your feeding behavior as well. And finally, in terms of the immune system, we see that if there is a deficiency in certain kinds of nutrients, that can have an impact on the immune function, right? And so we will look at the example of protein deficiency, how that leads to an impaired immunity. So now let's begin with an overview of what I'll be discussing today. So we're going to talk about how the parasympathetic responses from the autonomic nervous system will regulate the ingestion of a meal, and we find that the process of digestion can be divided into 3 phases. The first phase is the cephalic phase, which happens in the head. That's followed by the gastric phase, which happens in the stomach, and then the intestinal phase will be taking place in the small and large intestines. And then we'll talk about what are the various organs which are in the digestive system and how they play a role in the digestive function. So when you consider the mouth, we'll talk about the role of saliva, the tongue, and also how the teeth integrity can be affected by dental caries and how that can have an impact on the cephalic phase. And then we'll move down from the mouth to the esophagus, and we'll see how that if the ingested food doesn't travel down the way it is supposed to, it can lead to choking. We'll also understand how sword swallowers are able to perform their craft based on our understanding of the digestive system. And we'll see what happens when acids from the stomach move into the esophagus, and that's a condition known as GERD, and I'll explain what we mean by that. And then down in the stomach, we'll talk about the various types of secretions which are released in the stomach and how it's going to mix the food as well. And then I'll summarize what we've been discussing. So when you think about the autonomic nervous system, you have 2 types of regulation: the parasympathetic stimulation and the sympathetic stimulation. So the parasympathetic response is when you are relaxed, and that is going to facilitate the resting and digestion, and also the feeding and breathing response. So all of that is mediated by the parasympathetic division. And so we see that there are changes which take place in the eyes, like the pupil diameter. It's going to be smaller during this parasympathetic activation. There can also be an impact on the salivary flow. There will be more saliva which is produced, and if you are having the opposite response, the sympathetic response, you get dry in the mouth, and you can't even speak. And then we'll talk about how the vagus nerve is going to play a role in influencing some of the secretions in the stomach during parasympathetic activation. And I hope you will all be able to appreciate that if you are stressed out, and you're having this sympathetic activation, it's not an ideal time to eat. You want to eat when you're well relaxed, and I'll explain why this is important when you consider what happens in the cephalic phase. So before we get into the details of the 3 phases of digestion, I want to tell you how we can consider the organs of the digestive system. So we can divide it into two parts. You have the gastrointestinal tract, also known as the digestive tract, also abbreviated as the GI tract. So that is just referring to this long twisting tube which starts at the oral cavity, goes down to the esophagus, leads to the stomach, then to the small and large intestine, and it ultimately ends in the anus, right? So this is the first part. And when you think about the GI tract in the most simplest terms, you can think about the GI tract being like a donut. You know, it has an opening at one end and an opening at the other end. Now the second set of organs to consider are the accessory organs. So these accessory organs, you notice that they will be arranged in proximity around this GI tract. And the reason they are called accessory is because the ingested food will never move into the accessory organs, but rather these accessory organs will release secretions which will move into the GI tract, and that will help to in the digestive process. For example, we see that in the oral cavity, the surrounding accessory organs are the glands which produce the saliva, and so we see saliva is released into the oral cavity. And then down in the small intestines, we see that the neighboring accessory organs are the liver and the pancreas, and so the liver is going to release produce bile, which is going to eventually enter into the small intestine. That will help in fat digestion, and then the pancreas will release a number of digestive juices which will also break down the food in the small intestine. So we see that this is how the digestive organs can be classified, as the GI tract and the accessory organs. So as the food is moving through the digestive tract, we see that it can be the whole process can be divided into three phases depending on where the ingested food is. So the first phase to consider is the cephalic phase. This starts with the anticipation of food, and it continues with the ingestion and chewing, and finally this cephalic phase ends when the last mouthful of food is swallowed, right? So cephalic phase is what happens in the head, and it starts even before you even thinking about food can trigger the cephalic phase. And the gastric phase, it will start when the food moves into the stomach, and it will continue until the food moves out of the stomach into the small intestine. And the intestinal phase begins when the ingested food is going to enter the duodenum, which is the first part of the small intestine, right? And notice that it's referring to the ingested food as chyme, because once the food has been mixed with the gastric juices, it's got a very smooth consistency, and it's called chyme, right? Whereas when it's chewed with the when it's chewed and mixed with the saliva, it's called bolus, right? So those are just some technical terms to consider. And we see that as the ingested food moves through the small intestine, it's going to have a feedback effect on what's going on in the stomach. So it says it controls the rate of gastric emptying, and it can also coordinate the impact on other organs like the intestinal tract, pancreas, liver, and gallbladder. So these are things we'll consider in more detail when we come back tomorrow. So let's start with the cephalic phase. So what do we mean by the cephalic phase? So cephalic refers to the head or the oropharynx. So I hope you remember what we mean by oropharynx. The pharynx has got three parts, which we discussed in the respiratory system. Nasopharynx is connected to the nasal cavity, oropharynx is connected to the mouth, and the laryngopharynx leads to the larynx. And we find that the cephalic phase is going to be a response to food-based stimuli, which are neurally mediated through the parasympathetic nervous system. So cephalic phase is the response to food-based stimuli, which are neurally mediated through the parasympathetic nervous system. So what are examples of food-based stimuli? So some of this food-based stimuli could be based on what you see, and the food industry is very aware of this, and that's why you have all of these advertisements you see as you drive down the road, or when you're watching TV, or even scrolling through your phone on social media. These companies know the importance of visual stimuli. We also see that there are smells which can trigger the cephalic phase. It could be baking bread, or smell of pizza or vegetables, or sounds related to food such as the sizzling of bacon, or maybe the crunching of chips, even the opening of a soda can, right? All of these are sounds which will trigger memories related to food, and that can trigger the cephalic phase. So when the cephalic phase is activated, you have two types of responses, right? You could have secretory responses, and you have non-secretory responses. So you could have secretory and non-secretory responses. So examples of secretory responses could be the salivary flow in the mouth, right? And then there could be gastric secretions. And today we'll talk about the importance of saliva and these gastric secretions as well. And the role of duodenal and pancreatic secretions we'll get to tomorrow. And examples of non-secretory responses is the mixing and motility. So mixing and motility is both referring to the contraction and relaxation of the smooth muscles in the digestive tract. And mixing is just to mix the contents of the stomach, right, to help the churning, and so the food can be optimally digested. Motility is just referring to the fact that the ingested food can be moved along the digestive tract. So both those responses are going to be triggered during the cephalic phase. So we find that the overall goal of the cephalic phase is to improve and optimize the efficiency of both digestion and absorption of nutrients contained in the ingested food. So let's see what we mean by digestion. So digestion could be referred to the mechanical digestion, like chewing food, mixing it around. There could be chemical digestion due to the acids present in the stomach, due to the enzymes which are acting on the ingested food. And once all this digestion takes place, it's going to break down the food, and the nutrients in the ingested food can be absorbed into the small intestine, right? And from there it can enter into the bloodstream. So if you were to take away the cephalic phase, these processes which are happening downstream will be severely impacted. And even if you were to mix up the sequence in which these steps happen, that can also lead to problems, as we will consider shortly. So let's consider how the cephalic phase can be impacted, right? So in the case of COVID-19, we see that this COVID-19 infection can lead to a loss of taste and smell. And when you have a loss of taste and smell, that can have an impact on the feeding behavior, right? So when you can't taste or smell, the amount of food you eat will go down. And there are a few mechanisms suggested for why the amount of ingested food decreases. For example, we find that there is a decrease in the reward system, right? So the pleasure which you get from eating food is going to be less, because your sense of taste and smell, which plays a pretty important role in enjoying what you eat, is going to diminish. And when you don't have as much of a desire through this reward system, there's a decrease in your desire for foods during ingestion, right? And we also see that there is an early sensory specific satiety, and that leads to premature termination of the consumed food. So let me give you an example of sensory specific satiety. So let's say you have a bowl of chips, right? And then you want to eat something sweet, and then you can't eat that sweet thing. You'll come back to having something else, right? Because that sense of salty flavor has been satiated, and then you want to have something sweet, and then you want to go to some other dish. And so this type of sensory specific satiety can be reached much earlier when you can't smell or taste, because there are a fewer senses that you're dealing with, because those signals aren't being processed in your brain. So all this to say that, in short, when you have the sense of smell and taste affected, it'll impact how much you ingest. Is that clear, folks? How impacting the cephalic phase can impact how much you eat. That's the bottom line. Does that sound good? All right. So now that we've talked about the cephalic phase, let's talk about some of the secretions which are released during the cephalic phase. The first one is saliva, and that's released in the oral cavity. And saliva is just not made of water. It's also got glycoproteins, and the glycoproteins and the other substances make saliva seem sticky. Right? That's why it's drooling out of the mouth like this. And the viscosity in the saliva makes it possible to hold the food particles together when it's chewed, right? And if this saliva wasn't viscous, then the food won't be held together, it won't lubricate the food, and it'll make swallowing very difficult. So if you just try to take some powder and eat it directly, and you try to swallow it, your mouth gets dry and swallowing will be very challenging. So being able to lubricate the food and to facilitate swallowing is one function of the saliva. There are also a number of enzymes in the saliva. For example, there are amylase. There's the amylase enzyme, which will break down starch into simple sugars. And here's a simple test you can do to detect the presence of amylase in your saliva. So if you were to take a piece of raw potato and you put it in your mouth, initially it's tasteless, but as you let it stay there for a while, you'll start tasting sweet because the amylase will break down the starches and you'll have the sugars being released. You also have the lipase enzyme, salivary lipase, which will break down triglycerides into free fatty acids and glycerol as well. So this is a reaction we talked about, I believe, in lecture 4 when we talked about the metabolism. So we see two of the macronutrients, carbohydrates and fats, their digestion begins in the oral cavity because of the saliva, right? But the chemical breakdown of proteins does not take place in the mouth. It's going to take place in the stomach, as we will talk about later in today's lecture. We also find that saliva is going to play a very important role in taste perception because the molecules in the food which you ingest, they are going to dissolve in the saliva and then they will bind to specific receptors on the tongue, and that can lead to taste perception, right? So that's why saliva is important. And so back in 1979, this scientist Steiner did an experiment in Israel to see if whether these tastes which we can detect, are they hardwired or is it something which we learn? We know that the sense of smell is something we learn to find it as pleasurable or to have an aversion to it. But the question is, what about taste? And so he looked at the facial expression of babies when they were less than an hour old, right? So here are 3 pictures of babies. Their face has a normal appearance, so they're not tasting anything at this point. And it's important to note that babies can't detect salt, right? And so when salt was given, they would not have any response. However, when you give them something sweet, you notice that this little one here is smiling, the baby on the upper panel is also smiling, and so there seems to be a very pleasurable response to sweet. And this makes sense because they need to be able to detect the sweetness of the mother's milk, and this is a natural response. However, when something sour was given, notice how they pucker their lips and they're not very happy. Have you guys seen videos of parents giving their kids lemon wedges? Right, I'm guilty of that too, right? You'll probably think I'm a terrible person if I show you those videos. Anyway, but when they're given some bitter tasting foods, notice that they are just showing real aversion to the flavors, right? And so we see that in nature, bitter is a surrogate for poisons, sour is indicative of maybe foods being spoiled, and sweet is a indication of calories, right? So we find that these perception of taste are hardwired even when the baby is born. We also see that saliva has antibacterial properties because there are these enzymes known as lysozymes, and that can break the cell wall of the bacteria. Right? And so here's a trigger warning picture which I want to show you of what happens when saliva is not present. Right? So here's a picture of a 25-month-old bottle-fed toddler. Right? And so notice that this is a condition known as nursing caries, or the early childhood caries, or also known as the nursing bottle syndrome. So if a child gets into the habit of being put to sleep with a bottle of milk or maybe a bottle of juice, initially it's not a problem because the baby still doesn't have teeth. But once the teeth start erupting and then this habit continues, we find that the sugars in the milk and in the juice will start forming a coat and dental plaque on the teeth. And we find that during sleep, the salivary flow is going to be suppressed. And when you have low salivary flow, you have low antibacterial activity, and so the bacteria can proliferate, and that leads to tooth decay. And we will see in the next slide what is the link between saliva, sweets, and dental cavities. So when you see this last point here, you may be wondering, okay, why do we drool when we sleep? Right? And so if it's true that the salivary flow is suppressed, there are a couple of reasons for this. So when we sleep, when a person is sleeping, they may have been dreaming about food, and that could have triggered the cephalic phase. I told you even thoughts of food can trigger the cephalic phase. And while you sleep, the facial muscles get loosened, and so the saliva can flow out. And unless someone tells you, you don't know whether you sleep with your mouth open, right? So that can also be a reason for saliva coming out of the mouth. Okay, so now let's talk about the link between saliva, sweets, and dental cavities. So when the food we eat has sugars or starches and it's mixing with the bacteria in the mouth, it leads to this sticky, colorless biofilm, which is known as the dental plaque. Right? So when you brush your teeth, you're getting rid of this dental plaque. And when you don't get rid of this dental plaque, the bacteria will continue to break down the sugars further, and they will be using the anaerobic metabolism to break down the sugars, and the result of anaerobic metabolism is the release of acids. So the tooth gets bathed in acids, and as a result, calcium will start getting released from the tooth, leading to tooth decay. Do you folks remember the short clip I showed you of the lady who threw the chicken bones in vinegar solution and it all got rubbery because calcium leached out? So similarly, calcium leaching out of the teeth can lead to tooth decay. So dental caries are said to be one of the major public health concerns, right? As according to this global burden of disease report which was released. And when you think about the major causes, there seems to be a high intake of free sugars in our modern society. So free sugars is referring to the sugars in processed foods. And if you were to eat fruits, then the sugars are not free, right? They are bound to the various components which make up the fruit. And there's also a lack of removal of plaque by toothbrushing, and inadequate exposure to fluoride can also lead to dental cavities. So if you notice here, on one side causing the dental cavities are the bacteria and the sugars which help those bacteria to multiply, and opposing that we have the saliva which has the antibacterial lysozymes, and also fluoride can play a role in preventing cavities. So the question is, how does fluoride help prevent dental cavities? So to understand this, we need to take a closer look at the structure of enamel. So the enamel is made up of hydroxyapatite, which is mainly made up of calcium and phosphate ions as shown here. And if you notice this structure, in the middle you have these hydroxyl groups in this structure of hydroxyapatite. And when you use a fluoride toothpaste, this hydroxyl group will be replaced by the fluoride, and then it's called a fluorapatite. And this structural change makes the enamel more stronger and resistant to tooth decay. And so that is why this practice of community water fluoridation has been used to decrease the risk of dental cavities. So by adding fluoride to the water supply, then it's ensured that everyone who just drinks that fluoridated water will have much stronger enamel. But I just want to do a short tangent and tell you about some of the controversies related to community water fluoridation, and this is not something I'm going to test you on, but I think it is interesting to consider. So whenever policies are involved, you will, as you go through life, you'll realize that money is associated with it, and when you start touching people's pocket and their source of money, they're going to get upset. All right. And so there has been opposition to community water fluoridation. And as someone who's lived in Ithaca, New York for more than half a decade, right, I can attest that because they don't do community water fluoridation, if you ever live in a place like that, please use a fluoride toothbrush based on personal experience, and use fluoride toothpaste based on personal experience and also from talking to people I know. So what is the reasons for opposing community water fluoridation? So some people say that this is an example of mass medication, right? If you were to give a person medicine, you need their permission before you do that, and so mass medication is unethical. Others say it is just plain harmful. Others say that it's going to facilitate the dumping of toxic waste by aluminum and the nuclear industries. Others say that water should be pure, you should not add anything to it. But this is nonsense, because if you try to drink distilled water, those of you who have access to it, it doesn't taste good, right? So what gives water its flavor are the minerals dissolved in it. Others say fluoride makes the water taste different, but my favorite one is this, which says adding fluoride to water will lower your IQ, right? You all want to have a nice high IQ. And here's this study also reporting that, right? So whenever you look at some kind of study and people want to make a claim based on a study, it's good to actually dig in a little deeper and say, how do these people come up with their findings? Are there other potential explanations for this supposed finding, right? So it is true, they found that the level of IQ was lower in the places where there was more water fluoridation. But the interesting thing is, they did the study in places where fluoride was naturally occurring in the water. Now the concern with naturally occurring fluoride is that there is no regulation of how much fluoride is present, right? And also the place where these studies were done was in developing countries, and we know that a person's IQ is influenced by their environment, and depending on your environment and the resources you have, your intellectual development is greatly influenced, and so that may have been a confounding factor as well. So let's see what they found in a developed country like New Zealand, right? So this was a study where they looked at children who around the age of before the age of 5, if they were exposed to community water fluoridation, what was their IQ after over 30 years, right, of follow-up. So this is a pretty robust study, and they found no statistical significance, right? So as far as the current data shows that there is no impact of community water fluoridation on a person's IQ. Okay, can there be any fun ways in which we can decrease the risk of dental cavities? And yes, you could chew gum with xylitol. So xylitol is a kind of sweetener which will increase the pH of the oral cavity, right? Whereas the sugars broken down by the bacteria can eventually lead to a decrease in pH, and that leads to tooth decay. This has the opposite effect. And so they did a study among some children in Thailand, right? And these were children who had who were mentally challenged. And so they had two groups, one group with xylitol gums and the other one without, and chewing on this xylitol gum seemed to decrease the risk of dental cavities. So while we are on the topic of chewing, let's consider the technical term for chewing, right? And this is known as mastication. So chewing is something which we do multiple times a day without even thinking most of the times. But we see that this is actually a pretty complex process which is controlled by the brain, right? This is going to involve the alternated, symmetrical, rhythmic, and coordinated movement between the two sides of the dental arches, right? Just reading this description sounds pretty musical, right? Just like how in orchestra you need to have something coordinated, rhythmic. Yeah, that's how chewing is. And we see that pretty much the entire brain plays a role in this, right? The cortex is playing a role, the basal nuclei, the cerebellum, the brainstem. So pretty much every part of your brain is involved in mastication. And what I want you to take away from this slide is the purpose of mastication. Why is it important? So we see that chewing food is going to increase the surface area to volume ratio, right? And by increasing the surface area to volume ratio, we find that the ability of the salivary enzymes to digest the food is going to increase. So let me just walk you through what we mean by surface area to volume ratio. So here are three cubes, right? This biggest cube has the greatest surface area. As you can see, it's got a surface area of 216. Go to a smaller cube, surface area gets smaller, 96. Smallest cube, it's 24. But then when you look at the surface area to volume ratio, notice that the volume of this large cube is surface area to volume ratio is 1, right? Whereas the smallest cube, the surface area to volume ratio is 3, right? So don't trip up and say that mastication increases the surface area of the ingested food. No, that's incorrect. It's increasing the surface area to volume ratio, and this is an easy way to trip up people in multiple choice questions. Is this clear, folks? Surface area to volume ratio goes up, but the surface area alone is decreasing. So the chewed food, as it mixes with the saliva, it gets the term bolus, right? So from this point on, we'll use the term bolus. So how does swallowing take place, right? So in order to understand how the bolus will be swallowed, we need to consider a few structures which we talked about in the respiratory system. So it starts with the compression of the bolus against the hard palate, right? So the roof of the mouth, which is hard, is the hard palate, and the bolus is compressed against the hard palate. And then the tongue is going to retract and raise upward, and that causes the bolus to move to the oropharynx. That's part of the pharynx which is connected to the oral cavity. And as this happens, notice that the soft palate, which is found at the back of the mouth, that is going to elevate and it's going to seal off the nasopharynx. I told you the pharynx has got three parts. The most superior part is the nasopharynx, which is connected to the nasal cavity, and the opening to the nasopharynx is sealed by the soft palate. Okay, and what would happen if this soft palate was not sealing the opening to the nasopharynx, right? And you would have experienced this if you were drinking a liquid and someone made you laugh, and when you laugh, air is being expired out, and you may have experienced this, right, where the liquid you drink is going to be shot through your nose. Has this happened to anybody? Yes? Is it pleasant? Is it pleasant? No, it's not pleasant at all, right? So we can thank our soft palate when this doesn't happen to us. Okay, so now we find that as the bolus enters the oropharynx, we find that reflexive responses due to the smooth muscles found there, they're going to begin to move the bolus towards the stomach. But notice here that the epiglottis, which we encountered in the respiratory system, it's going to close off the entrance to the larynx, right, and the trachea. And as a result, we find that the bolus is going to move into the esophagus. Now, this is not always 100% foolproof what the epiglottis does, and so sometimes if a person were to choke, we can engage in a Heimlich maneuver to save a person's life. So let's watch a short clip on this.
It can happen in an instant. 1 minute there's friendly conversation around the table, the next minute someone's choking. Are you okay? According to the National Safety Council, roughly 5,000 people die from choking each year. Josh Mosley, a Mayo Clinic cardiac nurse, says when you see someone choking, it's important to remain calm as you let them know you're about to help.
So you want to place the thumb side of your fist against the person's abdomen, and then you want to apply the other hand on top of that, and then sharply apply pressure to relieve the air.
It's called the Heimlich maneuver.
1, 2, 3.
Mockley says to repeat the process until you see the object they're choking on come out of the person's mouth.
1, 2, 3. Are you okay?
Oh, yeah, thank you so much.
Yeah, you're welcome. Glad you feel better.
If the person loses consciousness before the object comes out, make sure someone calls 911 for help while you continue to work to clear the person's airway.
1, 2.
For the Mayo Clinic News Network.
Okay. So we see that choking occurs when a foreign object is lodged in the throat or the windpipe blocking the flow of air. Right? So if someone were choking and you think they're choking and you ask them, are you choking? And they say yes, you can walk away in peace, because if they're truly choking, they can't talk, right? There's an inability to talk, because you all can appreciate that in order to make sounds, air has to move through the trachea and then go past the glottis and cause the vocal folds to vibrate, right? So you know how sounds are produced. And so if they're able to talk, that means they are maybe feeling something irritating them in the throat, but they're truly not choking. Right, so we also see that there's noisy breathing or loss of consciousness if a person is truly choking. And so the way you apply this pressure is by doing J-shaped thrusts in the region below the sternum. And it gets a little more tricky when you're trying to help pregnant women, because you're trying to save 2 lives and not just 1. And so having proper training in Heimlich maneuver can actually save lives. Okay, assuming that there's no choking taking place, we see that the contractions of the pharyngeal muscles is going to force the bolus through to the entrance of the esophagus as shown here, right? So the question is, how does the bolus move along the esophagus? And so once it's in the esophagus, the bolus is going to be pushed to the stomach by what is known as a peristaltic wave, right? And here's where we see the role of the smooth muscles which line the digestive tract. And so let's talk about what do we mean by peristalsis. Okay, so can we move on to the next slide? Can we move to the next slide? Yes? All right. So peristalsis is the involuntary constriction and relaxation of the muscles of the digestive tract, and it's going to create this wave-like movement, right? And this wave-like movement is going to push the contents of the digestive tract forward. And so let's look at these rhythmic contractions. So right behind the bolus there will be a contraction, whereas in front of the bolus there will be relaxation, and that makes the bolus move a little bit further. And then again behind the bolus there's contraction, and in front of the bolus there's relaxation taking place. And this repeated cycles of contraction and relaxation is what helps to propel the food forward, the bolus forward. And we see that because of this peristalsis, you could even swallow food if you are standing upside down. Even though I'm not recommending it, it is possible. It'll move against the force of gravity, and food can move into the stomach. So we see that as the bolus approaches the stomach, there is this round muscle or a circular muscle known as the lower esophageal sphincter. And whenever you hear the term sphincter, it's referring to a circular muscle which guards an opening. We'll talk about another sphincter muscle called the pyloric sphincter. You have anal sphincters and so on. And so this sphincter muscle will loosen and allow the bolus to move into the stomach. And we find that there are some problems which can occur to this lower esophageal sphincter, and this complication can arise from, let's say, a parasitic infection. It could be due to complication in surgery, but if this lower esophageal sphincter doesn't close completely, it can lead to the acids from the stomach moving into the esophagus, right? And that can affect the esophagus, and this is known as acid reflux. And if this occurs more than twice in a week, it's called GERD, which stands for the gastroesophageal reflux disease. Now, some ways in which you can treat GERD is by taking antacids, which will neutralize the stomach acids. Other ways are through H2 receptor blockers or proton pump inhibitors. Now, these last two, we're not going to get into the mechanism of how they work, but just know that they will decrease the acids production in the stomach, and that can help alleviate these symptoms of GERD. So now let's talk about a dying art of sword swallowing, and let's see a short clip before I explain how these sword swallowers are able to accomplish their craft. Here's a short clip from Britain's Got Talent. Please don't do this at home. Okay, now let's break down the various steps of how this is possible. Okay, so we see that it's going to first involve the hyperextension of the neck, and if you remember the clip, you saw there was a hyperextension of the neck, and the purpose is to align the mouth with the esophagus and also to straighten the pharynx. So it's to that's why the neck is being hyperextended backward, right? And then we find that the tongue has to move out of the way, and the throat should be relaxed. And keep in mind that this sword which is used is going to be lubricated, and also it is not sharp, it's going to be blunt so that it doesn't cut the digestive tract. And after the sword is aligned with the gastrointestinal tract, it's going to be moved through the mouth, the pharynx, and also the upper esophageal sphincter. So just like how there's a lower esophageal sphincter, there is also an upper esophageal sphincter, and it's going to enter the esophagus. Now, one of the biggest challenges a sword swallower has to overcome is the gag reflex, and he has to learn to ignore that, and that comes with practice. Okay, so now that we arrive at the stomach, I just want to tell you what are some of the cephalic responses which take place in the stomach. We talked about the cephalic responses in the oral cavity, but let's see what happens in the stomach. So notice that the signals from the central nervous system are carried through the vagus nerve, cranial nerve 10, and it's going to innervate the stomach, and it will trigger the release of various secretions, right? So what are these secretions which are released in response to sights, smells, tastes, or even thoughts of food? So the first secretion which is released is the mucus, and this will coat the stomach walls. And this is very important because once the stomach walls are coated, after that you have hydrochloric acid being released. And if you were to switch up this order, then it can lead to gastric ulcers because the acids can damage the stomach wall. And then there's following that you have the release of pepsinogen. This is an inactive form of the enzyme pepsin. Now, if pepsin was released in its active form, it would break down the stomach wall because stomach wall has proteins in it. And pepsinogen is going to be converted into the active form pepsin when it interacts with the hydrochloric acid. So I hope you see why the sequence in which these secretions are released is very important. There is also a hormone known as ghrelin, which is a hunger hormone. So they find that its levels are high when the stomach is empty, but as the stomach gets full, the ghrelin levels drop. And last but not least, we see that there is another hormone called gastrin, which is going to be released, and gastrin can have further downstream effects, as we will consider shortly. So these are all secretions released during the cephalic phase, but notice that during the gastric phase, when the stomach is expanding with the food, we see that the gastrin can further enhance these secretions, right? So we'll talk about what happens in the gastric phase when we come back tomorrow. For now, let me just summarize what we discussed. We saw that the digestive processes are mediated by the activation of the parasympathetic nervous system. Saliva is secreted in the cephalic phase, and it has both digestive functions because of the various enzymes, and it has protective functions because of the lysozyme. And we saw how dental caries can be combated by community water fluoridation and proper brushing of teeth with fluoride toothpaste. And we also talked about the journey of the bolus from the mouth to the stomach, and that's possible through peristalsis. And we also saw how choking happens and how that can be treated with the Heimlich maneuver, and how sword swallowers can perform their craft. And we see that the lower esophageal dysfunction, lower esophageal sphincter dysfunction can lead to acid reflux. And we talked about a few gastric secretions, and you'll see its role in permitting digestion when we come back tomorrow. So thank you all for your time.